Imagine experiencing this sudden, intense burning and swelling right after intimacy. I mean, it feels completely raw,
Oh, yeah. It is incredibly painful.
right? And naturally, you assume it's a urinary tract infection or, maybe a really severe yeast infection.
Yeah.
So you endure the discomfort, you go to the clinic, you take all the standard medical tests, and they all come back completely negative.
Which is just a profoundly frustrating space for a patient to be in.
Totally. You're left with no answers, just this fiery, localized pain. So today, we are looking at the murky, often completely unspoken world of genital dermatology.
And it's a world where, honestly, when those standard cultures for bacteria or yeast come back clear, people are just often left feeling dismissed, like it's in their head.
Yeah, which is terrible.
But the reality is the overlapping symptoms in this area of medicine make the diagnostic landscape remarkably complex. We aren't looking for an infection here. We're often looking for an environmental trigger.
Which is actually the core mission of our deep dive today. We've got a really fascinating stack of sources for this one.
We do, yeah. Some really dense medical literature.
Right, we're pulling from the UK National Guidelines on the Management of Vulval Conditions. That's from the BSH and BSSV deal alongside multiple allergy, immunology, and sexual health clinical guides.
And we're using all of that to answer one highly specific but highly relevant question for you.
Can an unrecognized allergy to natural rubber latex condoms present purely as postcoital introital burning and swelling?
And, well, the short answer is yes.
Spoilers.
Right. But the how and the why and, the whole process of ruling out the other culprits that mimic this exact biological reaction, that is where the real science lies. We essentially have to treat this like a medical crime scene.
Okay, let's unpack this. If we're treating this like a crime scene, the very first thing we have to look at is the location itself. Because the vulvar and vaginal tissue isn't like normal skin, is it? We're dealing with a completely different biological environment.
You're dealing with a mucous membrane,
Right.
and that fundamentally changes how the body interacts with external substances.
How so? What's the structural difference?
Well, think about the outer layer of skin on your arm. That's the stratum corneum. It's highly keratinized.
Meaning it's tough.
Exactly. It's packed with tough, dead skin cells designed to be this impenetrable barrier. But the vaginal mucosa is non-keratinized. It completely lacks that tough outer shield.
Wow, okay.
Yeah, it has a highly complex, folded surface architecture. It's naturally moist, and most importantly, it is exceptionally permeable.
So it's not a standard shield of skin. It's more like a highly absorbent sponge.
That is a perfect way to look at it.
So whatever sits on the surface of that condom is getting a fast pass straight past the outer defenses and directly into the immune system.
Right, and that permeability is the absolute critical factor when we introduce natural rubber latex into the equation. It really helps to understand what latex actually is.
It's not just plastic, right?
No, not at all. It isn't just a sterile synthetic material. It is a biological product. It's the milky sap harvested directly from the Hevea brasiliensis rubber tree.
And trees produce sap for a reason. I mean, it's usually a defense mechanism, right?
It is an evolutionary defense mechanism. That sap is just packed with specific plant proteins, things like havine and patatin-like proteins.
Okay, and what do those do for the tree?
Well, when an insect attacks the rubber tree, these proteins basically help coagulate the sap to seal the wound and deter the pest.
Oh, wow.
Yeah, but when you process that sap into a condom and introduce it to a highly permeable human mucous membrane, those same plant proteins can easily cross that tissue barrier we just talked about.
Which completely explains why the clinical sources point out that women are significantly more likely to experience an allergic reaction to a latex condom than men are.
Exactly. The anatomical exposure to those proteins is just entirely different.
The mucosa essentially just welcomes the proteins right into the submucosal layers, right where all the immune cells live.
Yes, and so to directly answer the core question of our deep dive today, yes, an unrecognized type I latex allergy can absolutely present purely as localized contact urticaria.
Contact urticaria. Meaning what exactly? For the listener.
Meaning you experience hives, intense burning, itching, and swelling localized entirely at the vaginal introitus, which is the opening of the vagina.
Okay, let's talk about the timeline, though, because I'm looking at these immunology papers, and they clearly state that latex allergy is, it's a broad umbrella term. It covers two entirely different immune responses.
It does, yes.
So if you're experiencing this intense burning, How fast does a type I reaction actually happen?
A type I allergy is an immediate IgE-mediated response. It typically triggers within 5 to 15 minutes of exposure.
Whoa, okay, I need to pause on IgE-mediated for a second. We hear that term in allergy discussions a lot, but what is the actual mechanism happening in the body there?
Right, so IgE stands for immunoglobulin E. These are specific antibodies that your immune system produces when it misidentifies a totally harmless substance, like the plant protein from the rubber tree, as some kind of dangerous invader.
Okay, so it's a false alarm.
Exactly. Think of IgE antibodies as overly aggressive bouncers at a club.
I love that.
Right. They are attached to mast cells in your tissue. And the second those rubber tree proteins cross the mucosal barrier, the IgE bouncers recognize them, tackle them, and cause the mast cells to just instantly dump massive amounts of histamine and inflammatory chemicals into the surrounding tissue.
And that histamine dump is what causes the rapid vasodilation, like the swelling, the redness, and that severe burning pain.
You got it. It's violent and it's fast.
Okay, so that is the 15-minute type I protein reaction.
Hmm.
What is the second type of latex allergy under that umbrella?
The second one is a type 5V allergy. This is known as delayed hypersensitivity or allergic contact dermatitis.
Okay, delayed, meaning it's not the bouncers?
No, in a type 5E reaction, your immune system isn't reacting to the plant proteins at all. It is reacting to the chemicals used in the manufacturing process.
Ah, okay. The stuff they add to the sap.
Right. To turn raw tree sap into a stretchy, durable condom, manufacturers use chemical accelerators, specifically theorems and carbamates, in a process called vulcanization.
But if I'm tracking the biology here, a type 5E chemical allergy involves a completely different immune pathway, right? It doesn't use those fast-acting IgE bouncers.
No, it relies on T cells. T cells are part of your cell-mediated immunity, and they take a lot of time to recruit to the site of exposure, to multiply, and to actually launch an attack.
So it's a slower buildup.
Very slow. Because of that biological process, a type 5 reaction takes 48 to 96 hours to present.
2 to 4 days.
Exactly. And it typically presents as a red, itchy, scaly rash, really similar to poison ivy.
Okay, wait. So if a listener is experiencing intense burning and swelling immediately post-coitus, like within that 10 to 15-minute window, we can logically cross the type IV manufacturing chemicals completely off the suspect list.
What's fascinating here is that you are absolutely right. The timeline simply doesn't fit a T-cell response.
So it has to be the type I latex protein itself. Or, wait, if someone tests negative for the type I protein allergy, but they're still burning 15 minutes after exposure, what else causes a fiery reaction that fast?
Then we arrive at our most common suspect, actually. Irritant contact dermatitis, or ICD.
ICD, which is different from an allergy.
It is crucial to understand that it isn't an allergy at all. There are no IgE antibodies, no T cells, no immune system misidentification. Irritant contact dermatitis is a rapid physical or chemical injury to the skin barrier itself.
It's essentially a localized chemical burn.
A chemical burn or a mechanical friction injury. And to figure out how that happens, we really have to look at the condom's passenger list.
The passenger list, I like that, because condoms are rarely just latex.
No, they're not. They are frequently coated in commercial lubricants, artificial flavors, warming agents, and spermicides.
Okay, let's focus on the spermicides for a minute, because the sources single out one called non-oxynol 9. The audience probably knows spermicides can be irritating, but I really want to understand how it causes such immediate, severe pain. It's not just sitting on the surface, is it?
No, it's actively working. Non-oxynol 9 is a surfactant.
Like dish soap.
Essentially, yes. Its entire job is to destroy the lipid membranes of sperm cells so they literally can't swim. But surfactants aren't smart. They don't differentiate between a sperm cell membrane and the lipid bilayer of your own squamous epithelial cells.
Oh, no. So it attacks the body's cells, too.
It does. When non-oxynol 9 coats that highly permeable vaginal mucosa we talked about, it literally strips the protective lipids right off your own tissue. This triggers rapid cellular apoptosis.
Apoptosis, that's programmed cell death, right?
Yes. It is chemically inducing localized cell death, and massive rapid cell death causes profound localized inflammation.
So to the person experiencing it, that chemical apoptosis feels exactly like a severe allergic burn.
Exactly. Furthermore, these additives completely devastate the local vaginal microbiome. A healthy vaginal environment is naturally acidic, usually sitting between a pH of 3.8 and 4.5.
And that acidity is maintained by lactobacilli bacteria, right?
Right. So when you introduce heavily fragranced, chemically complex additives, or really alkaline lubricants,
You essentially nuke the acid mantle.
you destroy the pH balance, the lactobacilli die off, and the tissue becomes inflamed and highly susceptible to microabrasions. Which brings us to the mechanical aspect.
Friction.
Yes, friction. If the tissue is chemically compromised and there isn't sufficient lubrication, friction physically tears the mucosa at a microscopic level.
And we have to factor in hormones here too, because this isn't a static environment. The sources mention estrogen plays a massive role in tissue resilience.
Estrogen is what maintains the thickness, elasticity, and hydration of the vaginal walls. It actually promotes the storage of glycogen in the mucosal cells, which those healthy lactobacilli feed on to create lactic acid.
So as a whole feedback loop, what happens when estrogen drops?
In low estrogen states, which can happen during perimenopause, menopause, postpartum, or even while breastfeeding, that whole cycle breaks down. The mucosa becomes significantly thinner, drier, and way more fragile.
Okay, so let's put this all together. If you're using a flavored, scented, non-oxynol 9 coated condom without enough extra water-based lube and you happen to be in a low estrogen state,
You're in trouble.
yeah, you are chemically stripping the cell membranes, destroying the pH, and causing microabrasions on fragile tissue. You've created a perfect storm for severe irritant contact dermatitis.
It's not an infection, and it's not a latex allergy. It is a profound, rapid tissue injury, which perfectly explains why all the clinical cultures for yeast and bacteria return completely negative.
Okay, but let's throw a wrench into this. Let's say a listener takes all this in. They decide they want to isolate the variables. They ditch the latex condoms. They ditch all the chemical additives. They use nothing at all. And the intense burning and swelling still happens immediately after intimacy.
Oh, wow.
Or, terrifyingly, it actually gets worse. If we've removed the condom from the equation entirely, what on earth is happening?
Then we pivot to a rare but clinically vital differential diagnosis. If the environmental variables are gone, we have to look at the one biological fluid being introduced to the mucosa.
The semen.
Yes, we are looking at human seminal plasma allergy.
Semen contact allergy. This completely blew my mind when I read the immunology papers. It's a real documented allergy to the seminal fluid itself.
It is a type I, IgE-mediated allergy. It functions on the exact same immunological mechanism as the latex protein allergy we discussed earlier.
So the aggressive IgE bouncers are still triggering the mast cells to dump histamine.
Exactly. But instead of reacting to plant proteins from a rubber tree, the immune system is reacting to proteins synthesized in the human prostate. Specifically, a glycoprotein called prostate-specific antigen, or PSA.
And because it's the exact same type I histamine dump mechanism, the symptoms are identical. Severe vulvovaginal burning, intense itching, and localized swelling, typically starting within 10 to 30 minutes of contact with the seminal fluid.
It creates a notoriously difficult diagnostic puzzle for doctors. You have two entirely different proteins, one from a plant, one from a human, causing the exact same rapid, fiery reaction in the exact same location.
And I imagine you can't simply run a standard blood panel for seminal plasma allergy at your average walk-in clinic.
No, you definitely cannot. It requires specialized testing.
But the clinical guidelines offer a surprisingly simple diagnostic tool that you can do at home. To figure out which protein your immune system is attacking, you just use the condom as your control variable.
Right. This raises an important question of how to interpret that test.
It all comes down to whether the condom acts as a bulletproof vest or a murder weapon.
I really like that framing. If you wear a latex condom and it prevents the symptoms entirely, well, the condom functioned as a barrier. The seminal fluid never touched the mucosa and you felt fine. That points directly to a semen allergy.
Okay, but what if wearing the latex condom causes or worsens the pain?
Then the condom is the culprit. The seminal proteins aren't the issue at all. It's the latex plant proteins or the condom additives triggering the reaction.
So what does this all mean for the listener? Let's follow that second pass. Your detective work points to the condom being the weapon. The pain only happens when the latex barrier is used. We really need to look at the alternatives because you still need to protect your health without sacrificing safety.
Absolutely. The immediate recommendation in the guidelines is to switch materials to test the theory.
First on the list, polyisoprene condoms.
Yeah.
What exactly is polyisoprene and why does it solve the protein problem?
Polyisoprene is honestly a triumph of synthetic chemistry. Natural rubber latex is essentially a polymer of isoprene mixed with all those biological plant proteins we discussed.
That is sap.
Right. But in a laboratory setting, scientists can synthesize pure polyisoprene from petroleum-derived monomers.
This is made from scratch.
Exactly. The resulting material has the exact same molecular structure, Cis 1 below 4 polyisoprene, meaning it retains all the incredible elasticity, softness, and stretch of natural rubber.
But because it is synthesized in a lab and literally never touched a rubber tree, it is completely devoid of the having and patatin plant proteins that trigger the type I allergy.
Yes, you get all the structural benefits of rubber without any of the biological triggers.
That's amazing. Okay, what about polyurethane?
Polyurethane is entirely different. It is a thin, medical-grade plastic. It's completely latex-free and highly hypoallergenic.
And it feels different, right?
It does. Because it's plastic, it conducts body heat exceptionally well, which a lot of people prefer for sensation. However, it lacks the molecular elasticity of isoprene.
Meaning it doesn't stretch like rubber does.
Right. It does not stretch. Because it fits much looser, polyurethane condoms are statistically more likely to slip off during use, and they tend to be a bit more expensive to manufacture.
Okay, so polyisoprene is like swapping your wool sweater for a synthetic fleece. You get the exact same stretchy feel without the itch. Polyurethane is more like a thin plastic raincoat. It absolutely gets the job done, but it fits a little differently.
That's a great analogy.
Now, there is a third alternative that is heavily marketed to people with latex allergies, and the clinical sources issue a massive warning about it. Lambskin condoms.
Yes, lambskin condoms are manufactured from the intestinal cecum of a sheep.
So they're an animal product.
Right. Because they are an animal product, they contain absolutely zero plant proteins. They will never trigger a latex allergy. And clinically, they are effective at blocking human sperm, so they do prevent pregnancy. But the physics of the material make them incredibly dangerous in the context of sexually transmitted infection.
Because it's a natural membrane, it's porous. But like, how porous are we talking?
Well, the natural pores in a lambskin condom are roughly 1.5 micrometers in diameter.
Okay, and how big is a sperm cell?
A human sperm cell is relatively massive. The head alone is about 3 micrometers wide. So the sperm hits at the membrane, it literally can't fit through the pore, and pregnancy is prevented.
But viruses are way smaller than that.
Microscopic by comparison. The HIV virus is roughly 0.1 micrometers. The hepatitis B virus is even smaller, around 0.04 micrometers.
Oh, wow. It's like using a chain-link fence to keep mosquitoes out of your yard. I mean, it will stop a stray dog from getting in, but the viruses just fly right through the massive gaps.
That is the biological reality of the material, yes. The clinical guidelines are unequivocal here. Lambskin condoms do not protect against viral sexually transmitted infections like HIV, herpes, or HPV.
They are only a safe alternative if both partners have been recently tested and STIs are absolutely not a concern.
Precisely.
So let's say you swap your material to synthetic polyisoprene or polyurethane to avoid the latex proteins. But if you've been suffering from this burning for a while, your mucosa is likely inflamed, it has micro tears, and it's structurally compromised. How do you actually repair the skin barrier?
You have to eliminate all chemical and mechanical stress. The guidelines recommend switching exclusively to unscented, glycerin-free, water-based lubricants.
No warming agents?
No warming agents, no flavors, and absolutely no non-oxynol 9. You want to apply it generously to completely eliminate friction. You must give that delicate squamous epithelium an inert, lubricated environment where it can rapidly regenerate its cells without being chemically stripped back down.
And if you make all these changes, you switch to synthetic rubber, you use pristine, chemical-free, water-based lube, you eliminate all friction, and the intense burning still persists.
Then the home detective work has really reached its limit. It is time to see an allergist or a specialized dermatologist.
Because they have the tools to figure it out.
Exactly. Medical science has specific tools for this. They can perform a skin prick test to definitively identify a type IgG-mediated response to latex or to seminal proteins.
And for the chemical additives?
They can perform patch testing. They basically leave suspected chemical accelerators on your back for 48 hours to check for a type IV T-cell reaction. The point is, you do not have to endure the pain or guess blindly.
Which perfectly summarizes the mission of our deep dive today. We asked if isolated, immediate burning and swelling right after intimacy could be the sole presentation of an unrecognized type I latex allergy. And the clinical immunology sources say absolutely yes.
Yes, the high permeability of the non-keratinized vulvovaginal mucosa makes it the perfect gateway for plant proteins to trigger a rapid, localized histamine dump.
But as the science shows, arriving at that answer requires methodological elimination. You have to rule out the chemical apoptosis caused by spermicides. You have to rule out pH disruption and mechanical microtears.
And you have to rule out the identical symptoms of a seminal plasma allergy.
The ultimate takeaway for you, the listener, is to advocate for your own bodily comfort. Severe pain after intimacy is a biological alarm bell. It's not a baseline condition you have to endure in silence. Stop using irritating chemical additives, use high-quality water-based lube, use the condom as your diagnostic control, and if the pain continues, seek out targeted allergy testing.
The clinical tools exist, you just have to know to ask for them instead of settling for another negative UTI test.
Absolutely. Now, before we wrap up, the immunology papers hold one final, kind of mind-blowing quirk regarding natural rubber latex. It's a phenomenon you can actually test in your own kitchen. It's known as a latex food syndrome.
Oh, this is a remarkable example of molecular cross-reactivity in the human immune system.
Right. Because the defense proteins in the Hevea brasiliensis rubber tree evolved in nature, their molecular structure is surprisingly similar to certain defense proteins found in everyday fruits and vegetables.
It's wild.
The clinical data shows that up to 50% of people who develop a type I latex allergy will eventually cross-react to specific foods.
And that's because the immune system essentially relies on pattern recognition. Those IgE bouncers we talked about earlier, they are looking for a specific protein shape.
Right, a specific molecular profile.
Exactly. The proteins in certain fruits are so structurally similar to the latex plant proteins that the IgE antibodies bind to them by mistake. It is literally a biological case of mistaken identity.
I think of the immune system like a high-tech facial recognition camera. The plant proteins in the rubber tree are the known suspects, but the proteins in a banana look like the latex protein wearing a fake mustache.
That's hilarious, but scientifically accurate.
They are just close enough in shape to trigger the alarm system.
And that alarm system triggers the exact same localized release of histamine, just in a different mucosa in your mouth.
So if you suspect your condoms are giving you a localized allergic reaction, pay very close attention to your next fruit salad. If you find that eating bananas, avocados, kiwis, or even chestnuts makes your mouth tingle, itch, or swell, you might just have found the smoking gun for your mucosal burning.
It's an everyday clue that your immune system is already primed and waiting to attack those specific protein structures.
So the next time you are faced with murky diagnostic waters, remember that your body is constantly leaving you clues. From the exact timeline of the inflammation to the way you react to an avocado, you just have to know the science of how to read them. Until next time, keep questioning, keep exploring, and we'll see you on the next deep dive.